Hey everybody, this is Kevin McFarland from The Art of Emergency Nursing, and you're listening to 30 Days to Being a Badass ER Nurse. In the next 30 days, I'm going to give you some quick tips and tricks to help you be a better ER nurse. And of course, as always, it's not just me you're going to hear from. I've recruited some of my friends to give you some of their tips and tricks so they can share their knowledge as well. So don't forget to subscribe so that you catch all the episodes. And if you find one of these tips and tricks are really helpful, give me a shout out on social media and share it with your friends. Let's get into today's tip. Hey everybody, welcome to day 17 of the 30-day challenge, 30 days to being a badass ER nurse. And for today's tip, I have another pediatric tip for you. One of the most common things people say when I tell them I work in a pediatric emergency department is they say that they could never do it because they wouldn't want to deal with the parents. Well, I can tell you sometimes parents can be difficult. It's usually not the case. Most often the parents are in the emergency department because they didn't feel like they had any place else to turn and they needed something for their most prized possession. Oftentimes, a little bit of communication goes a really long way with these family members, and they're there to try to get answers that we could hopefully then provide. We're going to talk about some tips to help make it easier for you to deal with those difficult parents. One big concern is that oftentimes we know all too well that Dr. Google is often on the case. A little bit of knowledge is sometimes more dangerous than no knowledge at all, but they access information in various sources and end up creating a predetermined expectation of what the emergency department visit's going to look like. Now, that doesn't even include all their old wives' tales, family advice that they're getting from family members. I don't know how many times we hear of these not based in science or fact home cures all the time being tried on little ones because it's been passed on for generation to generation to generation. Now, with that limited information, don't get too defensive if they come in with either illogical or demanding particular treatment. Remember, you're the professional on the clock. They're not. Try to clarify their understanding and try to set the expectations early. A couple more tips. Put yourself in their shoes. Maybe you have little ones, maybe you don't, but imagine what you would be going through your head if you did have a little one and you were there with the knowledge that you had before you became a nurse. That will help kind of get you into the mindset of what these families are going through. Oftentimes they're incredibly stressed by the time they reach the emergency department, but they don't always show it. Even if they're not showing it, they may very well be stressed and overwhelmed. Ask lots of questions and clarify their understanding for the health topics at hand. It's a good time to do a little bit of health education, whether it's showing telling the expectations of when to go to the emergency department versus when to go to the urgent care, when you would go see one versus the other. There's lots of things we can be teaching patients all the time. So definitely ask some questions and clarify their understanding. That'll help you know what they know and what they can explain to you. Definitely use your active listening skills here. Show them that you're listening and show them that you're paying attention. Watch those nonverbals. Look for the question that's unasked. Make sure that what you are, the nonverbals that you have, make sure they match what's coming out of your mouth. If you're standing there with your arms crossed saying, "Oh no, I want to help you. I want to answer your questions," they're not gonna feel like you're there to actually answer their questions for them. If possible, give the parents choices or value their opinion. A simple question like, "Hey, this little kiddo has been here before and they've gotten an IV last couple times they've been here. Where did they get it? Or where's the best place to get an IV on them?" And see if they can answer those questions. This is a really simple way to kind of bring them into the care and have them collaborate with you on the care team of taking care of their pediatric patient. Well, I hope these tips help you a little bit when dealing with those difficult parents. It's never easy, but keep in mind that, again, they're under an incredible amount of stress when they're there in your emergency department. And by golly, that's what you're there in the emergency department for anyways. Take care of folks. I hope this tip helps. Have a great weekend and have a good shift.
Thanks for listening to the Art of Emergency Nursing podcast. Make sure to subscribe to the podcast and follow us on Facebook.